Now, on the sidelines of the National HIV/AIDS Research Conference, NHARCON 2018, researchers were worried about emerging infections that threaten the gains made in minimizing and eliminating HIV from the continent. They called for the urgent need to expand the scope of prevention and care for HIV patients on the continent.
HIV prevalent rate has dropped in the past years due to prevention, treatment and care, but new infections among teenagers are still high. According to the Society for AIDS in Africa, SAR, 60 to 70% of the African population, making up the adolescent population, are the most affected, making it necessary to tackle head-on.
In most countries, generally HIV is declining, but in two subpopulations, young people, adolescents particularly, and men who have sex with men, it seems to be rising. And you will understand with me that between this, it can go back into the general population. So those are the challenges. So the challenge is, how do we strengthen prevention for these two groups?
At a meeting to hand over to new council members, the Director General of the Ghana AIDS Commission, Dr. Mokwa Bledu Jemfi, entreated member countries to set up efforts to attain the 1990 goals of achieving an HIV-free continent by 2020. The country director of UNAIDS, Mrs. Angela Treton Monday, said HIV is no longer a death sentence due to the availability of antiretroviral treatment. She said, with interventions, lots of lives are being saved. Ghana hosts the Secretariat of the Society for AIDS in Africa, SAR. SAR's work in the sub-region entails promoting knowledge in HIV/AIDS, policy formulation and research into new opportunistic infections and trends in HIV. Over the years, SAR's response to HIV and AIDS has been guided by a 5-year strategic plan, which includes strengthening African health systems in the sub-region.